Keisha Washington, and I will be teaching a class today on HIV awareness. My objective is to decrease the number of individuals that have HIV in the state of Mississippi, and to demonstrate preventive methods of obtaining HIV, and to display knowledge about HIV. My goal is to bring awareness through teaching preventive methods, to demonstrate safe sexual practices, and also to teach the effectiveness of not getting random testing for HIV. Today's teaching method would be done through lecture, active teaching, and also demonstration. I have also brought a condom with me. This is one of the best preventive steps that any individual can utilize before having sexual intercourse. Everyone can see this? This condom is utilized by a male before sexual activity occurs, each and every time, ladies and gentlemen. It is very important. Once again, a contraceptive is very important to utilize before any sexual transaction takes place. HIV stands for Human Immunodeficiency Virus. The difference between HIV and AIDS is AIDS stands for Acquired Human Immunodeficiency Syndrome. The difference is AIDS attacks your white blood cell counts, and your white blood cell counts helps our bodies fight off infections and bacteria that causes pain to the body. Now, AIDS is generated through homosexual activity, heterosexual activity, oral sex, and also through sharing needles, which is called intravenous activity. And that's done through blood pathogens. So which means if I have AIDS and I share a needle with you or you, then that AIDS is then spread 3 ways. You get that? And also through sexual contact. If I have sex with one individual, that individual go have sex with someone else, and so far so on. That is called network spreading. And this happens all the time, sad to say, because it's better to have only one sexual partner. However, in most cases, we don't know what our other partner is doing at all times. Now, AIDS can also be spread through, a woman can spread AIDS through to her fetus, which is like if a woman is pregnant and she's having a baby. A fetus is an unborn child that is in the womb of the mother. Now, that can be done by giving childbirth. Then the child will be born with AIDS. Now, the doctor tests the baby once it's born. But the good news to everything is this, ladies and gentlemen, there are antiviral pills that are treatable for having AIDS. Once AIDS is treated, then you don't have to worry about it spreading. It will not cause the body any more pain or activity. In most cases, the doctor can get your white blood cell counts to a certain number, which will then start fighting back off of any kind of illnesses to the body. Now, once again, oral contact, sexual contact, homosexual contact, and also through blood pathogens is how we obtain sex. Now, what is homosexual contact? Well, homosexual contact is when 2 men have sex with one another, and that's through the anus. And for some reason or another, that has the highest rate of HIV in the state of Mississippi. However, heterosexuals have a high number of AIDS as well, but the homosexual race is higher than the heterosexual. Heterosexuals is like a man and a female. Blood pathogens spread through AIDS is like if you use a needle, or say for instance, if I have an open wound and I'm bleeding and you have an open sore, then my blood can go into your open sore, and that also will spread AIDS. So the best way to prevent AIDS is to get tested every 6 months. Before you have sexual activity with anyone, make sure that they are tested for all STDs. And contraceptives also helps you prevent any kind of STDs to the body. Because once a person contacts an STD, then their body is more effective and it has a higher increase of obtaining AIDS. Do anyone have any questions? Go ahead.
I have a few questions actually. Can old people get HIV?
Yes, they can. AIDS, unfortunately, they do not have no kind of person or anything that they just discriminate against. So anyone of age can get AIDS.
Okay, I have another one. If you are pregnant and have HIV, if you are pregnant, can you get HIV while you're pregnant?
Yes, you can.
Okay. Do condoms always work so you will not have HIV?
It does if it's just sexual contact, but once again, AIDS can be spread through a number of ways.
Okay, I have two more. Can two girls get AIDS?
Yes, they can. Oral contact is another way that females can obtain AIDS. But the good news about that is this. There are contraceptives for the time. However, unfortunately, I was not able to buy any, so I do not have any contraceptives that goes on the mouth. But also you can obtain STDs through oral contact as well, and you can get sores and blisters all around your mouth. So it's best to know what is going on with your other party's body before any sexual contact is transpired.
Okay, and I have one more. Can't you use saran wrap instead of a condom?
Saran wrap is a method that can be used. However, it is not 100% preventive because saran wrap is real thin and it will tear. So it's not a good policy to use saran wrap. Go ahead.
When somebody have open wound, can't you use gloves for them to stop from having that disease or anything that they have?
Yes, but how many of us walk around with gloves in our pocket?
Like
Unless
nurses and doctors.
nurses and doctors have gloves in their facility. However, on the streets near you won't know to just we don't normally walk around with gloves in our pockets. So the best way to handle a situation like that when you don't know if another person has AIDS is this. Could you stand up for me, sweetie? Say for instance, she has an open wound on her hand, but I would like to help her, and she's bleeding everywhere, right? What I would do is this. I will stand behind her, I will grab her elbow, because that way nothing is getting on me. And I will put pressure right here to her elbow to make sure that blood is not flowing everywhere. And then what I would do is, I would step this way and let the blood flow that way, and I would do that. And bring her to a faucet with running water and hold her hand out like that until I can get to some gloves. You understand? Okay, you may sit down. Now, once again, AIDS is preventable. HIV is preventable. And there are antiviral infection pills that will help you to stop generating this disease. Once AIDS gets into the body, unfortunately, ladies and gentlemen, when you go to have an AIDS test, you will test positive from that point on. But the good news is this: you can live with HIV, you can live with AIDS, and you can have a long, prosperous life. It is up to you the way that you prevent infections to your body, and also the way that you seek treatment. Antiviral pills will stop this virus from spreading, and it can also increase your white blood cell count up to where the white blood cells will once again start back to fighting off deadly diseases. If for some reason you do not seek treatment, and then the HIV will go into AIDS and it will tear down all of your body organs. So the best advice I could give to you today is make sure that you get treated make sure you get tested. If for some reason you acquire AIDS, do not be afraid to go ahead and get tested. Do not be afraid to take the medication. There are support groups where you can speak with other people who have this disease and that show positive ways of dealing with this disease. Because I don't want you guys to think it's the end of the world once you get this disease. You can live a long life and prosperous and have fun and do the same things that anybody else would do. However, the bad part about it is this. When you come in contact with a person that look good, you don't know what is going on with their body. So the best way to prevent getting this disease is to get tested every 6 months. If you decide to have a sexual partner, talk to him or her. Make sure they're tested every 6 months. That way you'll know what's going on with their body and you'll have a record of knowing, and you'll have the confidence of knowing, my partner is AIDS-free. He or she doesn't have no STDs or anything else. And once again, ladies and gentlemen, always use contraceptives before you have sex. What was that? Do you have a question?
Yes, ma'am. I like to know, do females still get, their periods if they have AIDS?
Yes. Female will still have her normal cycle every month. It doesn't change any of the normal things that happen to your body. What it does change is this. Your body may have flu-like symptoms. It may go into pneumonia if it's not treated. So again, if you get this disease, please get treated. Please get antiviral pills. Please take your pills every day, 3 times a day. Eat healthy, exercise, go on with your normal activities, and talk to people. Do not be the type of person that try to hide the fact that you're infected. Let other people know that you're infected to prevent this disease from spreading any further. Would that be all, ladies and gentlemen?
Yes, ma'am.
This is the end of today's session.